Hello everyone, I am Dr. Vivekanand, consultant urologist and andrologist at Bellanes Champion Hospital, Sarjapur Road, Bangalore. So today we'll know something about the OAB and its treatment. So OAB is overactive bladder, where there will be a frequent and sudden urge to urinate which will cause urinary incontinence, or due to this patient will have a lot of stress, anxiety and loss of confidence. So what are the causes for this OAB? OAB is caused due to a lot of neurological conditions like Parkinsonism or stroke or multiple sclerosis. It can be due to diabetes, a patient with anxiety, or a patient who is overweight, obese patient, or it can be due to loss of pelvic floor muscle weakness, which is seen in patients post menopause in women. So these are due to hormonal changes. So these are the causes which can cause, our patients who are all also on medications like diuretics can cause this OAB. So how can we treat this OAB? There are few simple measures which can control or get rid of this OAB, which can be followed up in home, which we call it as a behavioral therapy. So behavioral therapy, where you can just make some behavioral changes towards these symptoms to control them. So first and foremost in behavioral therapy is lifestyle modification. So in lifestyle modification, you can control the weight, or you can lose your weight if you're obese, reduce or stop smoking, decrease caffeine intake or carbonated drinks or artificial sweeteners from your diet. So then you can decrease weight, involve in physical activities. So these are few simple steps, and even know how much to drink water, or space between your water intake. So these are few simple steps which are lifestyle modifications we call. So next important step is like bladder training. So bladder training, where there will be a timed voiding or space between the urination. You should give some space, which where there will be frequent increase in your interval between urination. You can increase your intervals between urination to control these symptoms. You can wait for some time before you suddenly goes to your washroom, so that there will be increase in time, and gradually this time increases, so that these symptoms, sudden urgency and all, will slowly decrease. So next step is the pelvic floor muscle training. What happens in overactive bladder is there will be a weakening of the pelvic floor muscles, where due to this weakening, the sphincter, the muscles which control this urination voluntarily, will lose its strength, and there will be involuntary urination. So how to control this how to strengthen this pelvic floor muscles is of prime importance. So first you have to recognize which are the pelvic floor muscles which should be strengthened to control these symptoms. So pelvic floor muscles, it will be situated between your anal opening and between the bladder, which can be squeezed or which can be contracted voluntarily, and which helps in strengthening these pelvic floor muscles. So pelvic floor muscles strengthening exercises should be done regularly, and preferably in a fixed time during the days. So what you can do is, you can squeeze the pelvic floor muscles, then hold it for 2 seconds and relax in between, and this squeezing and relaxing has to be done for 10 times. So this 10 times, this is one session. So you have to do this in 3 sessions per day at least. So 3 sessions per day has to be done, and you have to do it for like few months to see this benefit. So you can increase this holding the squeezing time for at least, you can increase it gradually to 10 seconds, so that you will see more benefits as the time goes on. So these pelvic floor muscles should be done, like you can think like when you suddenly try to control the passing of the bowel gas. So that's how the strengthening of the pelvic floor muscles can be done. So pelvic floor muscle training is of very important in this, to control involuntarily passing of urine or stools. So this will strengthen both the anal control and even the involuntary passing of the urination. So these are few important steps which can be done even in home. So these are the called behavioral treatment or behavioral modifications for controlling this OAB or treatment of this OAB. So if you find more difficulty in this pelvic floor muscle training, so you can visit any nearby urologist or the physiotherapist, one who can guide you, can correctly training for your pelvic floor muscle strengthening exercises. So do visit a urologist if you are finding any difficulty or if it is uncontrollable with this initial few measures. Thank you.